We may be disabled, but we are not disinterested and we are not disinvolved. We read the legislation that affects us. We make the phone calls. We mail the letters. We send the emails. We are watching. We are organizing. We show up. And when we cast our ballots, we will remember exactly who treated our lives as an afterthought and who treated them as a priority. Thank you.
I don't know how many of my colleagues hang out with people on Medicaid, but I tell you around Rhode Island, who's on Medicaid? It's people with really significant learning disabilities. It's people with mental health issues that they're getting treatment for. It's people in addiction.
You wouldn't want free health care?
No, if I got it, I'd want to pay for it.
But why wouldn't?
Because I don't want nothing for free. What kind of world does people get shit for free? That's just ignorant.
Well, there's, you pay taxes into a system.
Nobody deserves anything for free.
Nobody deserves anything for free?
Nobody deserves anything for free.
What about public libraries, roads?
That isn't from the government. If it was from the government, no, we shouldn't have it.
No, that's from the government.
The roads are from the government. The government should do the roads. That isn't free. We're paying taxes for it.
Right. Well, you could pay taxes for health care.
Well, I don't want to. Everybody just pick their own doctor and go to the doctor they want to. When I need to go to the doctor, I go to the doctor and see them, and I pay them cash.
But you wouldn't want everyone to have the ability to have free health care?
No.
A very wise person told me that if I come down here just to talk about policy, you guys won't have any interesting clips to share when you get back to your news station. So let's start with this. Have you ever sat in a chair for 48 hours straight? I've been sitting in this chair for over 50 hours right now because my aide called in last night, and the night before nobody was scheduled. You probably didn't know until now, but this is common for people like me. I've been sitting in this chair since 7:30 a.m. Tuesday morning with a stage 2 pressure sore. To say I'm miserable is an understatement. Sounds unbearable, right? Turns out that's just preparation for this weekend. Tonight I get to go in bed and sleep, but when I get up tomorrow, I'll be back in my chair until Monday night. Just imagine what it must be like sitting in the car on a 6-hour drive somewhere, not even moving your legs or stopping for gas. It's almost impossible unless you're paralyzed. Just wanted to give you some perspective before I started this speech, because this is what me and thousands of other Wisconsinites experience on a regular basis. And we put up with it because it's still better than being in a nursing home. My name is Carl Scholze, and I'm a disability advocate. For the second year in a row, I drove my wheelchair 125 miles from my apartment in Fox Crossing all the way here to the state capitol because the disability community continues to be viewed as a burden on state budgets. Last year, I was pleading to get home health aides paid a living wage and warning people that there would be very noticeable effects from the $900 billion in Medicaid cuts that Donald Trump signed into law on July 4th, 2025. This year is different, however. This year, the danger is no longer hypothetical. Nobody expected the Department of Justice to say they don't view the Americans with Disabilities Act or the Supreme Court's decision in Olmstead versus LC as requiring states to provide home and community-based services to disabled people. Let me be crystal clear about what that means. The federal government is telling states in plain language that they will not be punished if they cut home and community-based services. Apparently, it's not a violation of my civil rights to put me in an institution against my will. Let me repeat that so it sinks in. The federal government is openly telling states there will be no consequences if they defund the very services that keep disabled people living at home. They have effectively given states a green light to warehouse us again. You're probably stunned right now. Unfortunately, that's just the tip of the iceberg. Remember the $900 billion in cuts I mentioned were signed into law last summer? That is exactly why the DOJ released this opinion. States are going to receive less federal Medicaid funding, and they will have no choice but to cut programs. And when they decide on what's cut, the programs that serve people with disabilities will be first up on the chopping block. That means people like me may soon be forced to choose between our physical health or living the rest of our lives in a facility. That's not freedom. That's more like a slow, bureaucratic form of imprisonment. The people who wrote and voted for that know this. They know I'll never receive a letter that says you must go to an institution, so they can sit back and claim that nobody's being forced. But as I just explained, one of the many ways it will inevitably happen is slowly cutting services. This is scary enough if you are in the disability community, but it gets even worse. The Office of Management and Budget in Washington, D.C. is rewriting the rules for how federal grants flow to states. In May, they released a sweeping proposal that restructures the entire federal financial assistance system. This includes a new political review process for grants, making it easier for agencies to terminate funding the moment it no longer aligns with the administration's priorities. And it means tighter central control from unelected political appointees. None of the people involved in this decision-making process were elected, by the way. They also didn't have to be confirmed by Congress. For Wisconsin, this means even more uncertainty and deeper potential cuts to independent living supports, caregiver wages, and the services that keep people with disabilities free. Now, I'm not sure why, but some politicians still seem to believe that these Medicaid cuts will never touch them. And if any of you are listening right now, let me assure you, those $900 billion cuts will affect you or someone you love as well. Disability doesn't discriminate by party, by bank account, or by the job you held the day before everything changed. A sudden injury, a progressive disease, or simply aging into the years of needed care can move anyone from independence to reliance on this program overnight. Don't get me wrong, I hope everyone listening lives a long, healthy, happy life and never needs to rely on Medicaid, but the numbers tell a different story. 56% of U.S. adults report that they themselves or a family member have received Medicaid at some point in their life. That number rises to 69% when you consider a close friend. The need is so massive that every single day, tens of thousands of Americans apply for Medicaid. Let's just stop and think about that. Every day, tens of thousands of Americans. It's an entire city reaching out for help every single day. And when Medicaid is cut, the damage doesn't stop with the person receiving care. Home care workers, nursing home facility staff, therapists, and the local businesses that support them, they lose hours and wages too. Cuts that look clean on a spreadsheet become concrete losses in every neighborhood in this state. I'm not out here campaigning for any one candidate. I'm campaigning for the largest minority group in the country. The only one that anyone can join at any moment. You're literally only one fall, slip, accident, or diagnosis away from being a part of this gang. We aren't asking for special treatment. We are asking for the basic services that allow disabled people to live with dignity and independence that we deserve. This isn't a partisan demand, this is a practical one. To the politicians who say they support us, we need concrete, practical ideas on where we go from here. Tell us your strategy. Tell us what viable options we still have. Vague statements of concern, they're no longer enough. We may be disabled, but we are not disinterested and we are not disinvolved. We read the legislation that affects us. We make the phone calls. We mail the letters. We send the emails. We are watching. We are organizing. We show up. And when we cast our ballots, we will remember exactly who treated our lives as an afterthought and who treated them as a priority? Thank you.
We are not asking for special treatment. That statement says so much. Think about what they are actually asking for. They are not asking for someone to give them a vacation, which is more expensive. They are talking about health care and support that can determine whether a person can remain independent or whether they end up needing much more intensive care. For someone with disability, losing a therapist or personal care service is not simply an inconvenience. It can mean losing mobility. It can mean losing ability to walk. And for some people, it can mean losing the ability to live independent.
So RFK Jr. just announced that they're cutting off Medicaid funding to California and Minnesota, and he claims it's like a punishment for the Medicaid fraud that was committed in Minnesota and in California. He threw out it happening under Governor Walz's, watch, and then under incoming Governor Becerra's watch. And I just got to tell you, this is going to fucking backfire wildly. Forget the fact that this administration got its position, took over the White House because of fraud. That every chapter of every book in the instructions on how to run this administration contains the word fraud. That this is nothing but a fraud machine and a fraud economy that's in that White House. Forget all of that. This administration is interfering with midterm elections. That's what's happening. They've got governor races they're trying to win. They've got House and Senate races they're trying to win. They are destroying the economy and everything. They've got nothing to run on. And so they're propagandizing the fraud that took place in these two states. Forget the fact that both of the Democratic administrations identified the fraud and prosecuted them pretty quickly. Here's why it's going to fucking backfire. Because there's a shit ton of Republicans on Medicaid. If you look up the 3 counties in Minnesota and in California, each of them, that have the highest number of Medicaid recipients, all of those counties are red. I want you guys to sit on that information for a second. Because we talk about red states having some of the highest Medicaid recipients, but now we're talking about blue states where the highest number of recipients are in red counties. Everybody think about that, okay? But you're going to piss off these voters of yours, these Trump voters. If their Medicaid gets cut off because you're trying to win those races in those 2 states, I don't know. Taking a big risk. But I'm going to end with this. The do-nothing Democrats that we have left that are still facing primary elections, I think there's like 18 more states holding primary elections. If we don't bring in even more Democratic socialists and progressives to build numbers going into midterms, nobody's going to prosecute what this administration just did. Because using Medicaid funding as a midterm tool, as a political tool to try to win elections, seems pretty awful fucking criminal to me. Crazy.
I don't want to pay for other people's health care, my brother in Christ. That's what insurance is. That's what it is. You pay money for other people's health care. That's how insurance works. Oh my God!
Well, it's official. Mike Johnson said Republicans are cutting Social Security, Medicaid, and Medicare to pay for the Iran war. He called all 3 of those programs entitlements. He thinks people are just out there living a fancy life with their Social Security and their Medicare, just going to the doctor whenever they're sick, getting chemo when you need it, and picking up your prescriptions. It's not cash, and it's not completely free. Not only have we been paying into it our entire lives, but it costs money every month for things like Medicare. It comes out of our Social Security checks. Not only did he say these cuts are coming in January, but remember, they have made major cuts in the big awful bill that won't take effect until January. They cut funding to our Social Security offices so that it would be more difficult for people to sign up and receive the money they're owed. These are not entitlements. These are basic levels of care that the United States of America, the richest country in the world, should provide for its elderly people and those who are disabled or those caring for those who are disabled. We have to pay for this war somehow. We have to help Don and Eric Jr. start their drone company somehow. If we don't get rid of these Republicans in November, we're all going to have problems.
I don't know how many of my colleagues hang out with people on Medicaid, but I tell you around Rhode Island, who's on Medicaid? It's people with really significant learning disabilities. It's people with mental health issues that they're getting treatment for. It's people in addiction recovery. It's people with really severe health conditions that interfere with their ability to earn a living. And all of those people with all those conditions are now supposed to be experts at red tape so that they don't get pushed off by employment reporting requirements. That's the trick. That's the stunt that's being used to knock people off Medicaid. The idea that fraud is out of control in Medicaid, to me, is not credible. What is credible is how many people, individuals, with significant disabilities, very often addiction, mental health, learning, are going to get clobbered by the red tape bomb that Republicans set to go off after the election.
So the Trump administration is doing this right now as we speak, and it's barely getting any coverage. And actually, it's mainly being pushed by Dr. Oz at the Center for Medicare and Medicaid Services. I guess Dr. Oz wasn't satisfied with the $1 trillion cut to Medicaid in Donald Trump's big, beautiful bill, so now he's going a step further and beyond what Congress did. Dr. Oz is proposing a new rule that would gut Medicaid payments to hospitals, which would add another $500 billion onto Donald Trump's already insanely high cuts to Medicaid. This is going to hurt people, and it's going to hit red and rural states the hardest, places that voted for Trump, places that are least equipped to deal with these Medicaid cuts. Millions more people are going to lose their coverage, and these states are going to have to make up ground elsewhere with property, income, and sales taxes, and that's according to Dr. Oz's own expert. Look, polling shows that Trump voters can be convinced on these issues, especially issues surrounding health care, so we need every Democrat running for Congress this November to be sounding the alarm about this stuff, because if Dr. Oz gets away with it, it would be devastating.
So Trump just said that it is impossible for him to take care of Medicare, Medicaid, and daycare. MAGA is so fucking stupid, okay? He is taking all of our money. He's taking every last dollar of the federal government and he's giving it to himself and his friends. He's cutting Medicare and Medicaid from the federal government. Watch. That's what he's telling us. And he doesn't believe in affordable daycare. So every time they want to force a woman to have a freaking baby that she doesn't want to have, and they want to tell people to have kids they can't afford, and then yell at them when they can't afford to feed them, this is what he's doing. He keeps telling us out loud, and I cannot believe that MAGA thought for 1 second that he was going to do anything to make our lives better. He's stealing our money every single day, and it's only going to get worse. He's now having our sons and daughters in a war losing their lives. So there's that. You MAGA, you suck. I cannot stand you people. You fell for it. We told you. You could not be more stupid. It's official. The Republicans cut Medicare and Medicaid, and Mike Johnson promised the president that Social Security is next in January. He said they wouldn't cut Medicare, but they did. They cut the prescription drug subsidy, and now people are going to be paying more money. They said they wouldn't cut Medicaid to U.S. citizens, and they did. They now want people who have cancer to prove every single month that they're too sick to go to work. Otherwise, they need to work 80 hours a month to keep getting their benefits, or they won't be able to be treated for cancer. When Mike Johnson says on a radio show that he's going to cut Social Security in January if they hold on to the House because he considers it an entitlement, believe him. It is amazing to me just how stupid MAGA is. The Republicans say we're not going to cut Medicare, Medicaid, and Social Security, and then they cut it, and then they keep saying, no, they didn't cut it. They said they didn't cut it. you're a moron. By the way, they already cut funding to the Social Security offices to make it harder for people to sign up so that they are delayed in getting their benefits. Because every month that you don't sign up, you're out that money, and they don't care. They want it for themselves.
Medicaid cuts coming from the tax law passed last year, the One Big Beautiful Bill, or HR1. A lot of the cuts in HR1 focus on the Medicaid expansion category, really a lifeline to Nebraskans and to our economy. But what proponents of HR1 got wrong is targeting this category with things like work requirements, new copays, and more frequent redeterminations, more frequent red tape. Over 90% of folks with Medicaid expansion are already working. The evidence shows that work requirements do not positively impact workforce participation. Instead, what they do is make it easy for folks to lose coverage, suffer worse health outcomes, and be less likely to be able to work. And the cost of the health of our neighbors and the support of our health systems is going to be really extreme. Governor Pillen and Nebraska DHHS have decided to implement the new work requirements as of May 1st, and that's causing a lot of confusion and concern. If I'm applying for Medicaid today, I need to have already met the work requirements in order to get enrolled in the Medicaid expansion category. If I got enrolled in Medicaid last year, but my renewal is coming up, that is when I'll be assessed for meeting the work requirements to keep my coverage moving forward. The first time that folks can lose coverage based on work requirements should be August 1st. We know folks are dealing with that right now. Folks have been getting notices that they're going to lose their coverage and face that really destabilizing impact of losing their coverage.
Did you hear what they just said? This is exactly why I think voters need to look beyond political slogans. When you are talking about health care, we are not just talking about Democrats or Republicans. We are talking about real people who need doctors, prescription, hospitals, and insurance. And now, this is where conversation gets interesting. If someone voted for Trump because they believed their financial situation would improve, but later discover that their health care costs are going up or their coverage is at risk, it's completely reasonable for that person to ask, did I make right choice? That's not necessary about becoming Democrat. During election campaign, politicians make promise, but after election, voters have to live with the policies. And healthcare is one of these issues where the consequences can be enormous. You can disagree with Trump. You can support Trump. You can be independent. If you are sick and you cannot afford treatment, political labor don't pay the medical bill. Now, let's talk about nursing home care and long service. For people who require day assistance, this service can be essential. And there's important point here. Care doesn't happen in isolation. There are nurses, therapists, caregiver, transportation provider, medication supplier, and the other workers who make this system function. When funding or coverage change, the effect can reach beyond the person holding the Medicaid card. So, and as someone who understands rehabilitation, this part really stands out to me. Yeah. And then there is another part of this conversation that we could not ignore. The people providing this service are workers too. If Medicaid funded service are reduced, provider may have few hours available. That can mean few workers hours or lower wages for therapists, caregiver, other workers. And when local business depend on their service, they can also feel the impact. So this is not simply as a story about government spending. It is a story about patients, families, caregiver, or health professional in the community. And I want to ask you something. Imagine that tomorrow you suddenly needed help getting dressed, moving around your home, and going to therapy or getting to medical appointment. Would those services still feel like special treatment? I know this is a political issue. People have different opinions about Medicaid spending, government budget, taxes, and how health care should be funded. And these debates are legitimate. But regardless of whether you are Republican, Democratic, MAGA, Independent, or something else, I think we should ask one basic question. What happens to vulnerable people when the service they depend on are reduced? We can debate how the service should be funded. We can debate how to reduce the waste. We can debate the government spending.